This video is sponsored by Wonderleaf Wound Dressings. When someone sues you for medical negligence, they're usually alleging that you've fallen short of your standard of care. But what is the standard, and more importantly, who sets it? Is it the textbooks? Or is it other health practitioners? Surely it can't be the courts, could it? That was the issue for the federal court in the case of Zulhasnimar binti Hassan Basri and another, and Dr. Kupu Velamani and others. What happened in this case was that Ms. Zulhasnimar had an elective C-section for supposed CPD in the year 2000. 2 years later, the patient had a second pregnancy that was followed up by the same doctor, Dr. Kupu. At 36 weeks, she was readmitted with abdominal pain. On admission, her condition was stable. There were mild irregular contractions recorded on CTG, so she was given pain relief. 5 hours later, she suddenly collapsed. She was resuscitated and rushed to OT 15 minutes later for an emergency C-section. Following the successful delivery of a baby girl, a hysterectomy was performed by Dr. Kupu and Dr. Malik Abu. They discovered that the patient had placenta precreta, which explained the acute bleeding and collapse. Unfortunately, the patient's earlier collapse caused a loss of oxygen to the baby, and she suffered severe birth asphyxia, resulting in her current cerebral injury. The patient sued Dr. Kupu, Dr. Malik Abu, and the hospital for failing to plan an earlier elective C-section based on her history, and that she was actually in labor based on the mild irregular contractions. In failing to do this, she argued, the doctors and hospital had breached their standard of care. Dr. Kupu's experts said that contractions had to be regular and progressive to establish that a patient is in labor, and that the doctors could only have known about the placenta precreta with surgery, as it was an incredibly rare condition. The High Court said Dr. Kupu and Dr. Malik Abu were not liable because they practiced properly as assessed by other expert medical people. This is known as the Bolam test. Rather unhappy with this decision, the patient appealed to the Court of Appeal and lost. She appealed yet again to the federal court, saying that you can't use the Bolam test to determine the standard of care, you should use the Rogers test. The Rogers test is based on a 1992 Australian case where the Australian High Court rejected the Bolam test, saying that the courts, and not medical people, should adjudicate the appropriate standard of care after considering the medical evidence and after considering the paramount consideration that a person is entitled to make his own decision about his own life. Unfortunately for the patient though, the federal court in this landmark decision sided with the doctors and said that we'll split medical negligence cases into failure to treat and diagnose on the one hand and failure to advise of risks on the other. For failure to treat or diagnose cases, we'll rely on the Bolam test to determine the standard of care to the extent that it can withstand logical analysis, and for the failure to advise of risk cases, we'll rely on the Rogers test. What this means practically is that it is now established law in Malaysia that if you are being sued for negligent treatment or a misdiagnosis, the standard of care is determined by your peers of similar skill and competence. If you are being sued for a failure to advise of risks though, the standard of care is what a reasonable person in the patient's position would think. This isn't the last time we'll see this issue of standard of care being raised. A few years later, we'll have the authoritative case of Dr. Hari Krishnan and another, and Megat Noor Ishak bin Megat Ibrahim and another. I hope you enjoyed this video. Let us know your thoughts in the comments, and if you like this video, you can support us by sharing, liking, and visiting our sponsor, Wonderleaf Wound Dressings at wonderleaf.com. Thanks, and I'll see you in the next video.